I'm Dr. Iram. I'm one of the consultants at Ankura Hospital's Attapur. Today I'm going to give you some information about uterine fibroids. Uterine fibroids are basically non-cancerous growths which are seen in the womb of a woman, that is, her uterus. The exact cause of a uterine fibroid is not known, but it has been linked to the female hormone estrogen. Female hormone usually peaks during the years of 16 and 50 of a woman's life. Hence, they are known to grow during this period. About every 1 in 3 women is known to have a uterine fibroid at some point in her life. The commonly seen age groups are 30 to 50 years. Women who are obese are known to have a higher risk of having a uterine fibroid, again because of the link to female hormone estrogen. The more number of children a woman have, the less her chance of having a fibroid uterus. Most fibroids are not known to cause any symptoms in a woman. That means she won't have any complaints even if she has a fibroid, which is usually incidentally seen on a scan. About 2/3 of women who are known to have a fibroid uterus will not have any symptoms. Only 1/3 of women can have symptoms associated with the fibroid. These can be heavy bleeding during periods, severe pain during periods, pressure symptoms which can lead to increased frequency of urination, pain during intercourse, constipation, chronic low backache. Again, the symptoms depends on the size and the location of the fibroid. The fibroid can be as small as a pea to as big as a melon. Fibroids are usually seen in the cavity of a woman, can lead to heavy bleeding. These are called submucous fibroids. Fibroids which are seen in the wall and the outer side of uterus, respectively called intramural and subserous fibroid, usually do not cause any symptoms unless they are very big in size. Fibroids are not known to affect the fertility of a woman unless they are very big, impinging on the cavity of the woman. That can sometimes lead to pregnancy loss or delays in conception. These fibroids are mostly non-cancerous. Very rarely, less than 0.1% of a fibroid can be associated with cancer. The treatment of the fibroids again depends on the size and the location of the fibroid. Very small fibroids not causing any problems do not need any treatment. Fibroids which are within the cavity of a woman that can cause heavy bleeding sometimes need removal surgically. Heavy bleeding caused by a fibroid can be treated with a coil Mirena, which is usually inserted in an outpatient setting in the womb of a woman, or other medications that decrease the bleeding, or hormonal medications. The pain associated with fibroids can also be dealt with hormonal medication or painkiller medications, over-the-counter drugs sometimes. There are injections which can be used to shrink the size of a fibroid. These are usually given over a period of 3 to 6 months, but not beyond 6 months. They have shown to shrink the size from the original size to at least approximately 30 to 40% over a period of 12 weeks. But the downside is, once we stop the injection, the size can go back to its original self after 4 to 6 months of stopping. Like I told you, fibroids within the cavity and causing heavy bleeding and delaying conception or leading to miscarriages can be removed under hysteroscopic guidance. That is, we use a camera, look at the cavity from within, and through an instrument we remove the fibroid out. This is called hysteroscopic resection of a fibroid. The other methods are laparoscopic surgery, that is keyhole surgery, where we can remove fibroids as large as 10, 12, 15 centimeters as well. Fibroids which are very big as the size of a 20-22 week pregnancy, can be removed through open surgery called open myomectomy. Sometimes the woman would want to remove her fibroid removed along with her uterus, or it can be suggested by her practitioner if it's causing heavy bleeding and no other methods have helped her. She's completed her family, or if that's the only option left, and or if that's the only option she wants for herself. Basically, fibroids can be dealt with in a proper manner. So if you have any problems, you can consult us anytime at any point in your life. Thank you.